Hi everyone. So today we are going to study regarding tuberculosis. We all know that tuberculosis is a worldwide public health problem, and it is considered the highest TB burden country in the world. Especially India is the country which is the highest TB burden country, right? Now, tuberculosis, it is caused by Mycobacterium tuberculosis, which is a gram-positive acid-fast bacilli. The points which I have underlined over here is a neat PG point. So they have asked many points, many times regarding the nature of the bacteria. So the bacteria is bacilli. It is acid-fast, and acid-fast in the sense it will take up the Ziehl-Neelsen staining, and gram-positive bacilli. Right now. Uh, this disease tuberculosis is called as the disease of the poor because it is often seen in slum dwellers, tribals and backward areas, and age group predominantly it affects 15 to 30 years old, right? Now we classified, there are many classifications, but here I am discussing the important ones, most important ones. No, classification based on drug resistance. We have monoresistance, polydrug resistance, multidrug resistance and extensive drug resistance TB. Monoresistance TB is resistance to any first line anti-TB drug. First line anti-TB drug in the sense, so there are 5 drugs which are considered first line, which is HRZDS. H over here stands for isoniazid, R stands for rifampicin, Z stands for pyrazinamide, E stands for ethambutol, and S stands for streptomycin. Alright, so if any one of the 5 drugs the patient is resistant, then we call it as a monoresistant TB case, right? Now we have polydrug resistance also. Resistance to more than one anti-TB drug except HNR. So except HNR, if the person is resistant to pyrazinamide, ethambutol or streptomycin, any 2 of the 3 drugs, any 3 drugs also, but except HNR. Why HNR we will be discussing next. If the person is resistant to isoniazid and rifampicin, then we call it as a multi-drug resistant TB. The main drugs in treating TB is isoniazid and rifampicin. These are the main drugs. The mechanism of action of these drugs, I'll be discussing it in the later part, but isoniazid and rifampicin are the main drugs. So they are considered resistant to isoniazid and rifampicin, then we call it as a multi-drug resistant TB. Then we have extensive drug resistant TB also. If the person is resistant to isoniazid, rifampicin and one second line injectable. Second line injectable are amikacin, kanamycin, capreomycin. These all mycins drugs are classified under aminoglycosides, as we all know. So any one second line injectable plus multi-drug resistant TB case is called as a extensive drug resistant, right? Now advancements have also come. Pre-extensive drug resistant TB case have also come. I will discuss it in the next part. What is pre-extensive drug resistant TB? Also there is this BPAM regimen which has come into action, which is also a recent advancement. I will discuss regarding the BPAM regimen in the later part. Next, that was the classification based on drug resistance. Now we have classification based on the treatment outcome. This is main the community medicine part, and also main neat PG point. They can ask anything. They can give you these lines and give option A, B, C, D. Right. Now, what is a cured case? Cured case is the person has been treated. So we have treated the person. So I'll tell you what is the treatment regimen. There is 2:4 months intensive phase and all that I'll discuss in the later part. That person has been treated, and also after treatment we took the sputum sample of that person and the culture came out to be negative. So the person is said to be cured. So treatment also completed, and we have evidence to show that the person's sputum smear came out to be negative. Now in the next part, which is treatment completed part, the person took the whole treatment, but we have no evidence to show that his sputum smear culture is negative. He took the treatment, but we don't have any evidence to show that culture has negative, sputum smear culture is negative. So that is the treatment completed case. Be very careful in reading the question. Here there is evidence and here there is no evidence. So cured and treatment completed, they both are completely different. Okay. treatment completed doesn't mean that person is cured, since we do not have any evidence. So these two are the potential NEET PG points you can be tested over here, right? Then treatment failed. What does treatment failed mean? That the treated the person has been treated, but after taking the sputum smear, we have culture positive report. Even after greater than or equal to 5 months, the person took the treatment for 5 months or even greater than 5 months, but the sputum smear culture came out to be positive. There might be many reasons for it. The person might have developed resistance against isoniazid or rifampicin. There might be many reasons, but he is treated, but sputum smear came out to be positive. Okay, that's treatment failed. The sentence clearly explains that the treatment is failed. Then we have lost to follow-up. The person did not start the treatment itself, or the treatment was interrupted for 2 consecutive months, right? So that is lost to follow-up. Okay. In these two cases are clearly explaining the sentence, the word itself, treatment failed, lost to follow-up. But these two you need to concentrate, right? These are the two. Here you need to focus. This is a potential. Next, for a TB case, if effective treatment is initiated within 48 hours, it reduces 90% of the infectivity. Infectivity, you all know, infectivity means the potential of bacteria to divide. So if we initiate the antibiotics treatment within 48 hours of case detection, then we can stop the division of the bacteria. We can stop the multiplication of the bacteria. So we need to initiate the treatment within 48 hours. So even this can be a future NEET PG potential point. Within 48 hours we need to start the treatment for TB case, and within 72 hours we need to start the treatment for HIV contact case. I'll discuss that in future regarding AIDS. Okay, so yes, now TB, it affects all ages. Here I've said predominantly it affects 15 to 30 years of age group, but it can also affect all ages, right? Next, what are the social factors causing TB? Poor quality of life, overcrowding, undernutrition, smoking, alcohol abuse, large families, and lack of education. So these are the social factors causing TB. Also, let me tell one point. These all points I have picked up from the Park Medicine of PSM, right? The third year MBBS students knows well the Park textbook, right? Next, so what are the investigations to carry out in order to detect the TB case, right? The first investigation is sputum smear microscopy. So sputum smear microscopy, first of all, how do we collect the sputum of a person? Collection of sputum samples. So what is the procedure to collect the sputum sample? So we collect 2 samples. The first sample is on the spot sample. On the spot sample means whenever patient comes to a clinic with symptoms, right? Symptoms of productive cough, symptoms of weight loss, right? So you will have to collect then and there on the spot sample. And the second sample, you will have to ask the patient to come the next early morning. Why early morning? Because the whole night sputum collection will be there, and then we can take that sputum, and then we will have to prepare the smear from that sputum sample and do the ZN staining. The process of ZN staining will also be explained in the later parts. Then the result, it is considered as positive if there are greater than or equal to 10,000 bacilli per ml of sputum. So this is the result. So it is positive if there are greater than or equal to 10,000 bacilli per ml of sputum. Alright. So this is how we conclude that the patient is having TB after seeing greater than or equal to 10,000 bacilli per ml of sputum. Next is culture. We culture it in the Lowenstein-Jensen medium. Now, whenever I hear about Lowenstein-Jensen medium, the 2 main points that click into my mind is, the first is that it is a medium to detect the TB bacilli, and second point is that this medium cannot be autoclaved. We know that all the microbiological media are autoclaved except 2 media, Lowenstein-Jensen media and Loeffler serum media. Why? These 2 media are egg containing media. We cannot autoclave them. We know that in order to autoclave microbiological media, we need to set the temperature at 121 degrees Celsius, right? At 15 minutes and 15 psig pressure. But Lowenstein-Jensen media and Loeffler serum slope, these 2 media are egg containing media. they cannot tolerate 121 degrees Celsius temperature. Yeah, so we insipissate them. So these two media, Lowenstein-Jensen media and Loeffler serum slope, are sterilized by the process of insipissation. So these two are exceptions. This is also a potential NEET PG point, right? They can ask you all the following media are sterilized by the autoclave procedure except. So the answer would be Lowenstein-Jensen medium or Loeffler serum slope, right? Yeah. So next point is we can either detect by Lowenstein-Jensen medium. Also, the point to be noted over here is that the LJ media will take 2 to 8 weeks to come out positive. It is very late, so it is least preferred. Next is we can do rapid test have come up nowadays, so we can detect the TB bacilli very rapidly, right? So the rapid tests are cartridge based nucleic acid amplification test or line probe assay, right? So the procedures and all, if you guys want to know, please comment down. I'll explain regarding these procedures also. Okay, next, but so we have read the case finding tools. The investigation, the overall investigation of the choice is smear examination of the sputum, but in India it is TrueNAT is also a rapid test, right? It is also a nucleic acid amplification test, right? Now other tests are, these are not the diagnostic test, but these are the supportive test. That if these tests comes out to be positive doesn't mean that the person has TB, but these are the supportive tests. If the chest x-ray comes out to be positive, and also interferon gamma release assay, tuberculin skin test. Tuberculin skin test is an example of type 4 hypersensitivity reaction. This is a NEET PG potential point. Also, gamma interferon release assay is based on whole blood of the person, right? So this is also a NEET PG potential point, right? So yes, so this is about TB. The other points regarding the TB will be discussed in the later part. Thank you.